Pediatric CT dose was a very important topic discussed at this morning's press conference, opening press conference for ECR. Professor Erich Sorantin from Graz was participating in this opening conference. Erich, do you feel that pediatric dose is uppermost in people's minds at the moment? Is it sufficient on their agenda?
I think it's sufficient on the agenda. It's also on all congresses and workshops, but the knowledge we have is not used as good and as much as we could. So there's a lot of room for optimization there.
Okay. Now, which particular techniques are you thinking of that people should be more aware of?
I think people should be aware of all factors influencing CT dose. There's numerous literature about that, but in particular what I propose is the half-slice thickness approach, meaning that there's an inverse relationship between dose and slice thickness, so we can reconstruct images after an examination with half of the slice thickness and looking if the quality is still sufficient. So we don't have to scan the patient another time, we just use the data we have. And if the slice thickness is, the quality is sufficient, we can estimate that we have 100% excess dose. So next time we will reduce that by 20%, just small steps, but they're also leading to the target.
Okay.
And we're moving, and we start the process again. And after a couple of investigations, we have an optimized investigation, and we have no investment for hardware, additional stuff. The radiographer and the radiologist can do that almost anywhere in the world where there's a CT machine.
Okay. In your own practice in Graz, do you use that on every study at the moment on children?
We have optimized our CT for protocols for children and adjusting the dose to children, and I'm proud to say that we just use 30% of the dose of others.
Okay, excellent. Now, is there any downside? You mentioned quality. Are there any other downsides that people should be aware of using the approach?
No, it's targeted to the image quality. And what is the different question is, what is the appropriate image quality? And in my opinion, it is the quality where I can make the diagnosis. So first the radiologist have to think about what is the task, what is the most likely diagnosis I have to do, and then he will know or she what will be the appropriate quality.
And do you explain to patients about to referring physicians about what you're actually doing in terms of the dose approach?
Yes, we are doing that. We are promoting that, and my colleagues in my environment know that, and this works pretty well.
Okay. It sounds like a very good, practical, easy to introduce measure. Are there any other points, any other similar techniques that you would recommend people look at?
We have developed the imaging chain, which includes all factors affecting CT dose, and we do that also in workshops where you learn how is the interaction between these different parameters and how to adjust.
Okay. How about industry? Are vendors doing enough on CT dose in children, do you think?
Vendors doing a lot in form of maturing technology. This is also maybe the point where everybody's believing that technology will do the job, which is not true. Yeah, the best car is nothing with the driver, and the bad driver doesn't get better with a new car. It still is a bad driver. So industry does a lot. In my opinion, there could be more options if we set up a new system about the children's protocols.
Okay. Now you're involved in Eurosafe, very important initiative launched 2 years ago at ECR. Could you tell us a little bit about that?
Eurosafe is now is on track. It's gaining more importance. We just completed an EC tender project together with other important institutions about diagnostic reference levels in pediatric radiology, meaning which examinations should have diagnostic reference levels and how should they be obtained. I think one of the major goals also of Eurosafe is that we are trying to combine information from several other sources. If it's the World Federation of Pediatric Imaging, is it the ESPR, the International Society of Pediatric Radiology, and a lot of others, WHO, yeah, that we focus our efforts and having one voice.
Okay, so overall the message is we're making progress, but there's still quite a lot to do.
Sure. Sure.
Okay, good. Well, I wish you the best for the rest of the week, and I hope your sessions go particularly well. Thank you very much.
Thank you very much.